So we're about to start. This is Celina. She's head of cyber risk management, but new big.
New book, yes.
I have been in the corporate world, so I know that in order for you to become a head of something, you need to be quite knowledgeable and experienced. So I'm pretty sure she have a lot to share with us. She also looks so positive. So feel free to bombard her with questions.
Yes, please do.
She have nowhere to go, so she have to
Capitalize.
answer them. So
Awesome.
whenever you're ready.
Thank you. All right, can you hear me? Is this on? Okay, perfect. So yeah, thank you for the introduction. And with that, I'll be talking about basically reframing a little bit of how we think about offensive testing and really how you can incorporate a risk-based approach to really improve offensive testing across all different phases of testing. So before we dive in, I'll just kind of continue the introduction to myself. So as mentioned, I'm the head of risk management at a cybersecurity services company called Nuvik. We actually primarily do offensive testing ourselves, but everything that we do is ultimately tied back to risk, just to make sure that executives and other folks who are part of the stakeholder group really understand what risk is, obviously how they should be thinking about translating those technical findings to tangible business impact. And I'll be stepping you through kind of how we think about that today. So going along with that, I also bring a lot of management consulting experience. So very much have been on the other side of this, where I'm working with executives who know they need something, aren't quite sure, don't really understand cybersecurity. And so kind of the opposite side, right? So what I'm trying to do with this presentation is basically bridge the gap so that you all can kind of take back to your teams, hey, if you have any executives or stakeholders or anyone else that you're really struggling to get that buy-in with, this is an approach you might want to take to really help them kind of get the value and understand what your teams are doing. So without further ado, since we only have about 30 minutes, I'll kind of dive in straight to the presentation. As mentioned, feel free, stop me anytime you all have questions. Obviously, we'll try to leave time for questions at the end. And then I'll try to obviously be around after the session as well. So to dive right in, basically, as I kind of teed up in my introduction, there are a number of reasons that offensive tests are sometimes less successful than they could be, and especially if you're working in-house where you possibly have additional constraints. The first is that typically, and these are some of the typical goals. I won't step through all of them since obviously most of us here are hackers in some form or fashion, probably know these things, right? But typically what your teams are tasked with doing is kind of ensuring technical compliance, ensuring obviously the effectiveness of different controls, and sometimes gaining a deeper understanding of the magnitude of effort, especially if you're undergoing M&A or kind of integrating systems over time. So with those goals in mind, one of the things that I've seen as I've been working with our offensive teams is that oftentimes there are several pitfalls that happen and kind of make testing less effective than it could be. The first actually happens throughout the scoping process, and this is especially true if you have stakeholders involved in scoping who don't understand the purpose of offensive testing, perhaps don't understand technically what's going on. And the biggest one that I often see is people actually try to save face, right? So they try to look good in front of their boss. They don't want all these vulnerabilities to come out. They basically try to tell a story around, oh, the program is so great, we have nothing at risk. And obviously, number one, that's just a false perception of security. But number two, ultimately, if something happens, they're going to look pretty silly anyway for not having gone and addressed those risks. And the second big one that I'll call out in the scoping process is just the lack of risk context. And again, that's what I'm here to really talk about with all of you today. And the risk context is something that's pretty easy to implement and kind of bring to your teams, which is why I'll be stepping through a methodology to do that. But really, again, from the scoping perspective, this is where a number of things start to go wrong if you're not thinking about risk. And then during and after testing, obviously sometimes, maybe your partner organizations aren't involved. Obviously providing findings in a void is not helpful. So we'll step on a little bit of these pieces as we go through. But hopefully some of these resonate with you all as things that we can discuss together. And then the outcomes from those, right? So typically, prioritization is one of the biggest things. If you don't know how things stack against each other, it's very hard to prioritize. Frankly, it's really hard to drive a conversation around business risk a lot of the time, again, if people don't understand. And then there's really this false sense of appropriate investment or resourcing, which obviously can lead to significantly different outcomes over time. So with that in mind, I'll go ahead and dive right into the bulk of the content, which is, again, taking a risk-based approach. And what I'll do is kind of tee up the approach, go through a case example of what we've seen serving our own clients, and then kind of step you through a couple examples of how to tactically think about bringing this back to your teams. So from the first piece, the kind of critical thesis of my entire approach is that risk is really the language that the business uses. They understand impact, they understand business implications. They oftentimes don't understand technical jargon. Hopefully that's not surprising to anyone, but unfortunately it has to be said. And going along with that, I also want to clear up a couple misconceptions that I often see when people think about risk. And the biggest one is that oftentimes people will conflate findings, threats, vulnerabilities, or issues with risk. And I would say these are certainly pieces that can help you identify what those risks are, but they are not risk itself. And very similarly, a lot of people will also think about criticality as risk. And what I would say is vulnerability scoring. So for example, if you're using CVSS scores, this is one part of understanding what risk is, but again, it's not risk itself. So going along with that, what is risk? My definition that I try to keep quite simple is that risk is just potential harm to the enterprise. And the more that you think about it this way, the easier it is to actually do that tying to the business implications, to tell a really compelling story about what's actually at stake. And oftentimes executives, again, will understand this language as opposed to something more technical. And I'll step through this piece quite quickly since obviously everyone here will understand this. But when I think about it as well, and this will come into the kind of more tactical methodology piece, typically the first step that I do when I'm translating technical findings to risk is just think about, from a CIA triad perspective, which pieces of this are actually being impacted. And so that oftentimes can help you understand then what the business implications and some of the other pieces will be over time. Again, these are just a couple examples. I'm not going to step through these since I think everyone here understands. But I do want to talk about the impact piece a little bit because I think this is the most important piece from a business perspective that really resonates. The first is around the lost access or lost productivity. And I often find that it's really helpful when you're talking to executives to frame this in terms of costs, as well as FTE time, anything related to pulling, for example, executive leaders into phone bridges. Their lost productivity has a super high opportunity cost, anything like that to make it very tangible. Going along with that, any fines or penalties. Obviously, this comes up a lot with regulatory issues, going directly into that legal or regulatory activities in addition to fines. Again, incident recovery, lost business, lost reputation. I think, frankly, now breaches are so common, it's kind of table stakes and consumers expect it to happen. But this can be, depending on your industry, all of the different contexts, right? From a competitive perspective, this sometimes can be a big thing that will resonate with executives as well. And the last thing that I would say also is think about, again, if you're talking about these with your team or you're looking at risk across the organization, think about some of the broader enterprise risks, right, that executives will be thinking about and how you can tie cyber to that. So typically strategic risks, operational risks, and financial risks are the biggest one that get overlooked. Obviously, legal compliance ties to cyber quite closely anyway. And again, reputational ties quite closely to cyber. And then, and I promise I'll move through the risk pieces quickly and get to the meat of the methodology soon. But a couple of resources, right, if you are looking to tell the story and you don't know where to start, things like looking at what frameworks your organization is using to measure risk. If you have obviously asset inventory, risk rubrics, any type of risk register and prioritization, you can get a pretty good idea of what's going to resonate and probably how CISOs and other folks are kind of communicating upwards to executive leadership and the board about cybersecurity. All right, so before we move into the case example and then the tactical methodology, I just want to give a couple key takeaways from the risk perspective. So the first one I would say is, and this goes very much to counteract the saving face problem, really think about reframing success as understanding your true risks as opposed to the top 300 vulnerabilities or whatever the other metrics might be. And again, use offensive testing to understand the issues contributing to those risks, but make sure you're communicating it. Yes.
I'm very sorry to interrupt. Oh. There's a raffle going on. It'll be really quick. If you have a raffle ticket, you can head in there real quick, get it, and then come back.
Perfect. No worries. No, the raffle's important.
Yeah.
No worries at all.
I want to let everyone know.
Perfect. So yeah, and so basically the key takeaway there is obviously from a prioritization perspective, once you know those vulnerabilities issues, you can use this risk overlay and then prioritize from there. And again, I'll kind of step through these two in a little bit more detail in a moment. But just, again, using the risk-based language to describe this as opposed to using that technical language. All right, so to really drive this home, I want to provide a case example that hopefully will resonate as to how we actually change the outcome of an offensive test for one of our clients. And so to provide a little bit of case context, right? So this was a very large US healthcare organization, about 25 locations, a lot of complexity, a lot of medical devices obviously embedded across their hospital system. This specific hospital system was actually undergoing an acquisition diligence. And so they were a target to be purchased by another healthcare system. The former CISO had been running the program for about 5 years and had mysteriously left as part of this M&A process. And no one could quite figure out why, but it becomes clear over the case example. They had previously undergone actually multiple penetration tests. They'd gone through a number of other assessments, including cyber insurance assessments, all sorts of different things. And the key piece that we found quite interesting were there were relatively few findings from all of those, which was especially concerning given how much legacy infrastructure there was, how much complexity there was within the environment. So kind of the spidey sense started tingling for us pretty quickly. And then as part of this merger process, they basically wanted to understand what were their key risks, the vulnerabilities, and obviously anything that the acquiring company could really use to negotiate during this M&A process. So again, all of us here understand the different phases of offensive testing, but this is kind of how I'll frame how we approach this from a risk perspective. So the first thing that we did actually took place in scoping, as I mentioned earlier. I think scoping is actually one of the best places you can start to incorporate risk throughout an offensive test. So the first thing we actually did was we very explicitly aligned with them on wanting to understand the greatest risks as opposed to the vulnerabilities, the total number of findings, et cetera, et cetera. And we were very purposeful about that because our spidey sense was kind of tingling. We were like, oh, you don't have a lot of vulnerabilities previously. There's something hinky is happening here. Similarly, we tried to avoid artificially constraining findings. And obviously, I know every offensive test, right? You have to scope. There will be limitations. Totally fine. But in this case, we suspected that they'd probably been a little bit too narrow in their scoping in previous tests in order to look good. And therefore, basically wanted to make sure we weren't falling into the same trap and could really give them, again, that very clear risk perspective. Third, we really tried to facilitate the mindset shift away from the intuitive trap of limiting findings. Again, this is just a lot of time with their team. And the second thing that we had in our back pocket was there was a recent non-technical risk assessment that we had also performed. And so because that was non-technical, we were able to go in and do interviews with a lot of stakeholders, read their policy documentation, and kind of start to understand what was going on with their CISO, some of the things that folks would just casually share with us on a call, like, oh, this guy was great, but like X, Y, and Z, insight to his personality and his program, which ended up being super helpful. So again, from a scoping perspective, started to put risk in there from the very beginning. So phases 2 through 4, right? So this is all of your reconnaissance, mapping, discovery. So what we did was we actually started with OSINT, which I think obviously everyone starts with. And it was really fascinating because even from our very basic, just web crawling, like all of the things, it became immediately clear that there were some pretty significant gaps that just had not been captured on previous pen tests. And they really directly contradicted this perception that the program was functioning great, that there weren't these major vulnerabilities. Similarly, the review of the non-technical findings from the risk assessment really helped us understand, okay, number one, we should be targeting some additional things during our discovery and exploitation process. But number two, our suspicions about the CISO were pretty much correct. And it turned out actually he'd done a lot of time on policies, put all this documentation in place. And then as we saw, multiple gaps, the actual implementation of the technical controls was really not there. And then lastly, again, significant discrepancies were identified throughout, right? Which didn't surprise us, really, really surprised our client, given they've been scoping these other tests so narrowly that it actually looked like the program was quite successful. So from an exploitation perspective, multiple things happened. So the first was that they had tried to really solve a lot of their quote unquote problems, right, and to protect themselves by just spraying and spraying with different tools. Frankly, that wasn't a good investment for them. Some of it wasn't even turned on or configured correctly, but they were like, oh, we have vulnerability management, we have security testing, we do all the things, which obviously is just not sufficient, especially when you're looking at it from a risk perspective. We were ultimately able to get domain access, and we are actually doing a physical pen test as part of this as well. So we were able to physically walk in, access nurses' stations, access all sorts of devices. And frankly, that was quite scary, and they didn't even realize. And then the last one was, again, just all of the exploitations as we started to do our interim check-ins with the client really highlighted that this perception of security was completely wrong, and they weren't thinking about risk to the organization or to patient outcomes, frankly, at all. So lots of costly fixes, which I'll talk about in the reporting section, so again, talk about the risk layer first. So we framed all of the findings in risk language. And the nice thing about that was it really helped gain the buy-in from all of the different executive stakeholders. And when you're talking M&A, this was the chief financial officers from both companies, the CEOs of both companies, and frankly, the CISO was kind of the most junior person in the room in both cases. And so it was quite interesting having this risk-based discussion with those executives as opposed to being super technical with it. Going right along with that, as we framed it out in risk terms, we really created this risk-based prioritized list of remediations. And again, keeping that risk context in mind allowed us to say, okay, here are the things that you should do that are table stakes, regardless of whether or not the acquisition goes through. And we were also able to say, okay, if the acquisition does come to fruition, here's what we recommend prioritizing first. Here's what you probably just want to rip and replace, and kind of giving them that full world of understanding of not just the magnitude of effort, but really the tactical sequencing and some of the different ways they should think about it as they integrate it. Going right along with that, once we had this list, we could really give them in millions of dollars the kind of total amount of money it would take to replace legacy systems, probably integrate and upgrade as they did this acquisition. And then really just made them aware that, hey, you need to have your eyes wide open. Just having these programmatics, so having documentation, having kind of the right meetings in place doesn't make your security program strong from a risk perspective. And so I think between these two and putting a dollar figure on what was actually needed to remediate this was quite compelling for them. And I don't think we would have been able to do that if we hadn't taken the risk-based approach. So a couple of key takeaways from the case. So obviously, first and foremost, just think about incorporating risk across the entire offensive testing phases. Again, just thinking about business decisions are made on risk as opposed to any kind of technical, using risk to discuss trade-offs, and then framing difficult news, obviously using risk language. So that's the case. Any questions or anything from you all? Yeah, go for it. Yeah, please.
The first one is like, did you figure out why the CISO quit?
Yes. So yeah, I kind of buried the lead there. So it turned out he basically saw the writing on the wall coming with the acquisition. And so as soon as he realized that, number one, the healthcare system acquiring them had a really good CISO who was very deep technically and had basically a really strong offensive testing regime, he kind of saw the writing on the wall and was like, this is going to come out. I want to leave while I still have a good name, have a recommendation. So that was one. And then the second piece was, I think he also basically just realized that the perception of security was so strong that he would look really, really silly when that came out. And so it was a really interesting 1-2 punch of he left early enough that it didn't look too suspicious until we got kind of deep in the testing. But it was also fascinating because all of these folks, this company, again, very legacy, very large healthcare system, all of those folks had worked together for 5-10 years and knew each other really well. And so it was a very interesting conversation for us going to his peers and saying like, hey, this guy was in meetings with you. He gave you this perception. Sadly, now you have a lot of extra work to do as a result of, because this impacted HIPAA and, you know, all of the different pieces, right? So it's quite an interesting conversation, but yes, that's why he left.
Looks like a smart sideshow.
Yeah.
Save his ego.
Well, he clearly is very good at the political parts of his job, so.
No, that's not the only one. Okay, so the other question that I have is, okay, you find all the stuff, all that is right, you write the report, you send the report out.
Yes.
Do you personally and your team or in general, can you do something extra to make sure that your report is actually being worked on, right? Do you, how often do you follow up? Because
totally.
These are two different stuff, like find it, report it, and then fix it, right?
Yes, 100%.
Do you have some hands-on, like, yeah, any strategies or?
Yeah, that's a great question. So there are two things, and these actually typically take place in the scoping process. So first and foremost, we typically encourage retesting where budget allows and time allows. And whether that's, you know, immediately after, so like 3-6 months after, whether that's just kind of like an annual recurring process. So very much so we try to go in and obviously just make sure people are doing their homework. So that's one. The second thing is we really try to have as much face time as we can. So typically for every report, what we try to do is actually not write the report and send it, but write the report and then actually meet with the folks who will be responsible for doing things. So in this case, we actually had, I want to say 5 or 6 separate readouts with different teams. So it was, you know, and we had frankly 2 separate sets of deliverables in this case, one for the acquiring company where we gave them much more information, one that was a little bit more tactical for the team that was being like the diligence target basically. And basically what we did was we just had separate meetings with each of those groups of stakeholders to say, here's the reality of the situation. How do we communicate this to your boss? And we also made, frankly, different reports as well. So we had one that included like the 300-page results from Nessus. I'm not kidding. It was literally, I think, like the biggest scan results we've ever had. We had all sorts of things, like we looked at their asset inventory. So we had like captured all of that data for them. We had a key questions document that one of the executives wanted. So we prepared that for them. Obviously, board briefing deck, all sorts of different things. So I think the key takeaway there is just targeting it for whatever the audience is so they can understand. And then to your point, obviously doing retesting where possible just to make sure that obviously things are getting done. Yeah, great question. Yeah, for sure.
So what was the example of like the previous test, which were good, very down?
Yeah. Yeah, great question. So there were a couple different ways that so basically they were trying to cover their bases. And it was really interesting. One of the things we saw was on their cyber insurance policy, it was all like very check the box, right? So it was, have you done whatever your compliance testing is? Have you gone through and done HIPAA high trust testing? Have you done HIPAA security rule testing? And it was really interesting because the check the box answer was like, yeah, we have. And then when we started looking at the documentation, again, it was very, very high level. So on the risk assessment side, which I was involved in, it was very much like, oh, do you have a policy for X, Y, and Z, which obviously security rule is looking for. And we would look and the policies were all, it was very clear they'd just gone into like HIPAA policy.com or whatever, downloaded templates, put in their name, and then basically that checks the box that you have this. And it was very similar on the pen test side where they had been very strategic in basically saying, oh, we want to test X, Y, and Z system that they already knew had appropriate controls around it. So that was one problem. Another problem that we saw was in a couple of instances, they just basically didn't give access. And so what the team was trying to do was effectively like the opposite of an assumed breach, right? Like kind of black box. But the problem with that is like we never got access to anything, not by any fault of the team, but just like, again, we were basically hitting like EDR and firewalls and things that they knew were going to stop us. And so it was just not in a very effective way of getting testing, but it looked great to them because they're like, oh, no vulnerabilities, perfect. So kind of, yeah, exactly.
Probably like that, to get in everything is.
That was exactly what we noted. Yeah, so exactly. So once you were actually within the perimeter, lateral movement, basically anywhere, very limited segmentation, especially for some of the medical devices, all sorts of operating system issues, like going back to, I think, Windows NT was the earliest we saw, like a lot of problems, right? But to your point, like they had invested, again, very strategically in like the pray and spray tooling, had some of it that worked quite well, but that, again, is not reflective of the true risk within the environment. Yeah, of course. All right. In the interest of making sure I get through the whole thing, before I get crushed by the, the backdrop here. So one thing I do want to just quickly demo, and I have a couple examples, we'll probably get through a couple, like 2 or 3 of them. But really just giving you all some examples of how I work with my teams to translate some of these technical findings to risk. I won't step through all of this because I've kind of given the high level overview. So again, think about this scoping, testing, reporting. And typically what I'll do is basically we'll have our whole list of vulnerabilities, right? Obviously prioritize using CVSS, using whatever, critical, high, medium, low, whatever you want to use. Typically then, as I mentioned, we'll tie this first to the CIA triad. And then what I typically like to do, and I've given an example you probably can't read here on the end, is basically take the CIA and then tie it to what's the business context, what are the business implications, how do we then think about how this risk or impact actually ties to the business. So to go through an example, or actually before the example, I guess, these are more so questions that you all can use with your teams. Typically, again, try to tie it to immediate cyber or IT implications, obviously thinking about associated costs, very much getting to the business problem, and then any broader business implications as well. It's pretty straightforward things you're probably already thinking about, but maybe not explicitly calling out yet in reporting. So the first one from an exercise perspective, so this was actually directly from the previous case I just stated, right? So found a ton of legacy systems, including OS, throughout the hospital environment. These no longer support patching and are not segmented. Seems like a pretty obvious one, right? But frankly, it took a little bit of coaching to get our team to think about this. So the first one's, again, tying it to CIA. So obviously can gain admin access from a confidentiality perspective, getting access to all sorts of sensitive data. Again, exfiltration, especially when patching on certain systems is not being done. Lack of segmentation obviously could allow an attacker to actually move laterally with the environment, which we demonstrated was possible. And then any system modifications, right, with domain access as well. And then obviously, if you wanted to, you could potentially take systems offline, causing outages, other pieces around that. So this piece should obviously be pretty straightforward. I think this is probably something that everyone's doing on a regular basis. The piece that may not be as obvious is really the business impact from the risk. And this is where you can really tailor this to the context of your clients, your organization, whoever you're doing the testing for. And I try to make these a little punchy. Obviously, some of this is hyperbole in these examples. The first one, obviously, from a hospital context, exfiltration of data can lead to significant regulatory issues, obviously fines, potentially, changes in patient outcomes, obviously, if you're modifying certain systems. And then the last one is, if there's an outage, what is the actual cost in terms of time, value of time, and obviously just tactical financial issues, right? So this one was pretty straightforward. The next one that I like to do, and this one's a little bit more fanciful, but actually this was a finding that we had on one of our assessments as well. This was a corporate office building where they literally had one network and no logical separation of anything, which was shocking to us. And what they didn't realize was that all of their systems, including cameras, elevator control, HVAC, the whole shebang was all on the same network, which actually was also accessible via guest Wi-Fi. And guess what? Guest Wi-Fi didn't have a password. Super fun. This feels like it's shocking. It is, but it was real. So again, I try to make these a little bit fun. So obviously lack of segmentation, any IoT devices someone could get access to, could perform meddler in the middle, obviously gain additional access to data and confidentiality there. From an integrity perspective, they were even able to be demonstrated to reposition surveillance cameras. And then with, this is kind of a facetious one, right? But theoretically, if you wanted to, you could use that access to actually physically enter the office. And then similarly, you could potentially disable security systems, modify the elevator patterns, all of those good things. And then with my last minute here, I'll step through these. Again, this is a little bit fanciful for demonstration purposes, but theoretically, if you're trying to tell a story, you can get to whatever the ultimate outcome would be. So meddler in the middle attack, obviously exposure of data, pretty straightforward. Bypass of security systems, so you could vandalize the corporate office, get in, do all the scary things that we heard Michael talking about earlier in terms of gaining access. And then obviously this is kind of a fanciful one that did not thankfully come to fruition for our client. But like basically you could disable things, make it much harder, obviously, if it's there. And so with that, just a couple key takeaways to leave you all with. Again, just the business understands and thinks in terms of risk, so make sure that you're doing so as well. Right along with that, obviously consider impact to the business, and consider all of the different pieces of CIA as you do so. And then basically just go through and again, be as prioritized as you can and really tie it to kind of those tactical investment outcomes. So any thoughts, questions? I think I am almost perfectly on time. If you're interested, feel free to connect with myself. I can go back to my intro page. Here, if I just skip up here. So this is me. Feel free if you want to reach out, connect on LinkedIn. Obviously, have any questions. We also do obviously offensive testing, but if you're also curious about this methodology or want us to kind of chat more about what this would look like for you all, happy to do so. But yeah, thank you. Appreciate it.